Robert, I think Robert gave us a very powerful example of how a new therapy, in this case, bedaquiline, can be used as a catalyst to drive collaboration. 4 immediate high-level takeaways from me. One is the sheer number of logos on the slides. It's a lot of different players. Second, the importance of time, speed of approval and rollout. Third, the need for practical tools to deal with the market failure issues. And your last slides demonstrated the importance of turning off the tap, the sheer scale of the problem. Our next speaker, Angela Siemens, Vice President, Food Safety, Quality and Regulatory at Cargill, brings another perspective of the collaboration and partnerships required from the food, animal health, and plant health angle.
Yeah.
Angela.
Awesome. Thank you so much. And it is just an honor for me to be in front of this forum here. Disclaimer, right? I am not a medical, not a veterinarian. I am an animal scientist with a meat science emphasis, right? Totally foreign to a lot of what you're talking about. So it's been fascinating. But in my background, I have been pulled into food safety. And one of the things in working with Cargill, and I'll go into Cargill just a little bit, is the fact of can we, when we approach issues, and I get into this with my employees in the plants and everything, we tend to think in our silos. And we don't look outside for solutions and pathways to be able to help us with, our potential issues. And that's what I'm here for. And one of that is to, okay, back out of the medical kind of conversation. Let's take a look at where we have, attacked global issues and what have been the pathways in being able to do those outside of the medical realm. So that's where I'm headed. It will not be medical terms whatsoever, moving forward. But let's talk about Cargill just a second here. And a lot of you may not know who Cargill Incorporated is, based in Minneapolis, private company, with the largest private company in the world. We have an awesome family and board that supports the activities of our company. We're in 70 countries, 150,000 employees. Our business is in nourishing people, right? We play in the food supply chain across the globe, all the way from a lot of production. We depend on farmers. We depend on the livelihood of farmers across the globe. That is our business. We know food is not produced in many of the areas that need that food, right? It is produced and then needs to be moved to other places. We have a lot of food insecurity in the mix. And so there's a lot of activities that we do to assure that we can promote food production in parts where it needs to be supported, but also how do we move that food in different places. Also, we have a recognition of responsibility. Our customers and consumers are telling us that we have to do it responsibly. They are more and more concerned about how we are doing our system, right? And so a lot of our activities have shifted to taking a look at how do we be transparent? What are the things that we do to produce food? And the AMR issue has come into that. The use of antibiotics has come into that conversation, right? Because consumers are there, and I'll come back to that in a minute. But you can see one of the foundationals to Cargill is in this employee and food safety space. And that's the space that we have been working for many, many years in terms of how do you take food safety and some standards and apply them globally. Food business is global. And the impacts of an issue in China no longer just affects China, right? Huge amount of exports that come out of China and go global, and in many other parts of the country as well. So there has to be some understanding of what it is to be food safe and how do we not transfer issues around the globe. Food safety is a model. I already talked about that a little bit. The questions that were posed to me talked about how can partnerships be leveraged to integrate food safety, animal health, and plant health? How can different entities come together to pursue a similar vision? What are immediate strategies needed to strengthen these partnerships to ensure the greatest impact reducing AMR? Right. All I got to do is remove AMR from that sentence, and those are the 3 statements that we've struggled with in food safety. These issues are not new in terms of how we disseminate information, how do we improve systems, how do we How do we move knowledge around and make the world globe better, in this? So I think there is a model here that we can do. I'm going to jump into a couple organizations that have been developed over time to attack this issue of how do we take the best practices in food safety and move them across the globe. Right? Now, one advantage that I have in the food space is that it's a competitive space. It can be driven by the marketplace in many places. And so I think in animal agriculture, as it relates to AMR and the use of antibiotics, we're going to be able to use some of that same competitive pressure, through to move forward in programs in animals. I struggle a little bit on how that works on the medical side, but I do think some of the partnership piece applies. So with that, keep that in mind in the perspective as I move forward. The Global Food Safety Initiative came out of the Consumer Goods Forum, which is based in Europe. Long history. Let me go in here. This has not been a short-term project in going forward. In the late 90s, there was a lot of emphasis about food safety. And we had a lot of organizations, and I was in manufacturing for another company at that time. Every customer that we had a different set of requirements on what it meant to be food safety in our manufacturers. And we were seeing a huge proliferation of requirements, not unlike what I've heard here over the last couple days, right? We've got stewardship programs, but this one has A set of criteria, and this one has C set of criteria, not always the same and the same outcome based. We were seeing that in the food sector as well. But at the end of the day, the outcome was to be the same. How do I improve and guarantee that if I'm purchasing spices from China, right, or I'm doing chicken out of southern US, could I assure that I had a safe food supply? The goal was the same. So what this group did out of the Consumer Goods Forum, set an independent group up to say, can we bring the best of the best together globally? With that, what are the standards that we could agree to that would move us forward in food safety? And it didn't matter if we were a developing country or a non-developing country. There is a minimum criteria of what it means to produce safe food. Right? We can differ and we can debate about some of the little criteria, but overall, foundationally, there's a lot of things we can agree on. This started in 2000. Really, it wasn't until 2007, 7 years, where we got agreement from 7 major retailers that what they would do is agree to programs that were based on this global standard. It didn't really matter who was doing the verification of it, exactly what the audit might look like or the criteria of the audit, but if it met this basic criteria, they would say that that manufacturer was meeting the minimum criteria for food safety, and that manufacturer could enter then their food supply chain, right? One of the things that struck me in all the conversations that I've heard the last 2 days is there's little verification in the medical industry that these stewardship programs and some of these programs are doing what a hospital says they're doing. In the food industry, we can say we have a program, but you know what? I've got a third party in auditing against a standard, and I have to get a certificate annually or every 3 years that says that I'm meeting that standard. I don't hear that, and that's outside of government. We can do this because it's occurring in the private sector. Very different than I know many of the medical pieces of it where, you start talking about audits and things, you end up in the regulatory realm. We pulled this out of the regulatory realm. This is in the private sector and voluntary. So you could go in and you could do the audits and you can create the certificates. It gave us a tremendous amount of flexibility to move faster, more efficient, and I believe more effectively in doing it in the private sector along that lines. So I go on down through here, and I've got a lot of slides, and I'll leave these, you're going to have access to the slides. But what has happened has just been amazing through here. They are now on their 7th edition of the updates. This is not a static standard, so 7th edition over 15 years. means that we are taking best practices and continuously moving forward with them. They've also started a global summit, food safety specialists coming in, but it's just not the microbiologists sitting down, right? It's the retailers, it's the manufacturers, it is the consumers are involved in this session and a dialogue. Also governments. What this is allowed to do is, in particularly countries that had not focused on food safety regulations, a dialogue has started with the private sector to say, okay, private sector has pushed this set of standards. It appears to be working globally. Is there something in that that can be moved into the regulatory environment? And so there has been a tremendous amount of facilitation between government to government, because the worst thing we have, that we deal with, is the non-harmonization of regulations globally in the food space. That is our #1 hurdle to getting food into the right places on security. But we've also had, government to business meetings. This has created a facilitation of that conversation, one basic conversation with one platform, and being able to move these things forward. Have they been successful? There's 85,000 certificates were given in 2013. I think that number is up. 162 different countries. In terms of how the private sector has moved this into the countries very quickly, in that time frame. Lots of folks involved. There's different schemes. You don't have to be held to one scheme, but foundationally, they're all based on the same outcome standards moving forward. Now, a couple things about the vision and how you set an organization up like this. This organization needed to be focused, right? Once you kind of set a global organization up, and we get lots of calls from lots of people of, can you help us with this issue, this issue? No, this was a focus on improving food safety, right? It wasn't to go in and do AMR. It wasn't to do, a lot of other things. It was a focus on here, and I think that's one reason that they were successful, in that they had one goal to focus on how do we bring equivalence and convergence between effective food safety management systems, right? So when I talk to someone in China and they've received a certificate, I know what the standard is by which they've received that certificate, and I can have confidence in the product they're sending me. It does not make policy for retailers. They don't do any training. It is about the standard setting, and that's what they do. Now, it does leave a gap, right, in here. And one of the gaps that we've done is there's been other organizations that have stepped in and looked at some of the training aspects, right? How do we take this into, one thing I didn't mention and go back to is there was a recognition that a lot of countries and businesses don't have the resources to meet these standards, right? So do you just leave them out of the marketplace? No, they're important to the market. I mean, you've already seen some numbers in the food supply and in the animal supply, where 80% of it is all small producers, right? Small manufacturers of a food that comes through the system. They've adopted what they call a go-to-market system in there, in a pathway for someone that is resource constrained, no knowledge or no regulatory support, to get to certification. And a recognition by the retailers that if someone comes in and works in that process and continues to go from basic, intermediate to advanced, that they can sell into the marketplace while they're going through that process, even though they don't have a certificate. They're not giving certificates to people who do not qualify for the overall standards, but they are recognizing those people that are trying to improve their process. And we've heard lots and lots of stories, particularly in developing countries, that says, you know what, I go about this process and it not only helped us with food safety, but all of our other processes improved because they had to put a food safety management system in. If you put a food safety management system in, you generally bring along some production management systems. So there's correlated benefits that have occurred, and these folks have been open access to more markets moving forward. SAFE has helped with some of that training. In the middle. So we've been involved. Now, this one actually came out of an issue with HighPath AI when it went global, right? There were a lot of entities in this world that across the globe that did not have the support, right? the technology, the training necessary to be able to contain the spread of high-path avian influenza. So how did we do that and working with that? There were a lot of, private members that combined with public entities to see how could we get training into those parts of the world where they didn't have the infrastructure to do it, right? Tremendous amount of persistence. So you heard the word before, in these processes. SAFE does a couple things, but the one I want to focus on is facilitate education and training in food safety in developing regions around the world. And they do this on a project-by-project basis. So they're filling that gap. We got standards, right? How do we get it to the various countries? One of the most recent ones, and you can get into other work, they're on the web, in that process, but they're rolling out a global dairy farming food safety training framework that can be used. In cooperation with GFSI, right, what are the minimum standards in food safety? This is also a parameter here where we can maybe put other things in training as well. I've got one more piece here, and I've got just a short time here. I can't leave a conversation in animal agriculture relative to antibiotics without talking about competitive versus pre-competitive aspect to this, right? I've had lots of folks talk to me, in here, in that how can we get to pre-competitive discussions when antibiotics, particularly use in the U.S., is a competitive advantage, right? I've got some slides here that talk about consumers are asking for this, and they're willing to pay some premiums, and there are companies stepping up and saying, hey, we're going to meet that market demand that we have, right? But to solve this overall, we need to have pre-competitive discussions, right? And I think both can occur, right? There is a gap here on folks that agree the antibiotic-free meat is important to them versus those that are actually buying that. Now, that's a market opportunity, right, for folks. How do I get those other folks that care about that into it, and how can we, bring more product to market? So there is a differentiator that occurs, right, in the marketplace, right? So a company, especially in the U.S. in a competitive set, right, is going to look for that differentiated competitive position. They're going to have improved performance and long-term growth. I'm challenging the industry because food safety was declared a non-compete item in 2001 by the meat industry. I have more conversations with my competitors in the food safety space than I do most of my leadership in my company, because it's a non-compete. We recognize that anybody that had trouble in food safety affected everyone else in the food chain, right? Not quite the same space in antibiotics. So I just got one more slide. I do think we can have these pre-competitive conversations, and we need to have these pre-competitive conversations, even in light of the competitive position that occurs in the marketplace. So stewardship, best practice testing, how do we get metrics aligned? We can have those conversations, and know that is different than the medical, but it's a part of what we have to deal with in the animal agriculture sector. Industry efforts have occurred. I do think the food safety experience, and particularly as we move forward, stewardship can be akin to food safety management systems, right, on that, right? So can we set a foundational baseline and then be able to work that through in a global fashion so that I don't end up with 10, 12, 15 different baselines that we have to target. We can target one, and how we get there can vary. So with that, thank you so much.
Angela,